Good morning, good afternoon, and good evening, everyone. I'm delighted to welcome you all here today for this second session as part of the AIWF and Pfizer collaboration, DEI by Design, Women's Leadership and Legacy in Health, which we jointly launched in December 2022. Through this initiative, AIWF and Pfizer aim to create positive and impactful platform to develop the next generation of women leaders in health, mainstreaming a powerful shift in workplace culture towards true gender parity and encouraging both corporate policy change as well as decisive shift in the narrative on women's leadership in health. For that first session, a high-level diversity, equity, and inclusion panel explored the importance of mentorship, role modeling, recognition, and visibility in empowering women in progress to progress their careers in health sectors in the MENA region, in discovery, research, and innovation. In this second session, a high-level diversity, equity, and inclusion panel will explore the importance of mainstreaming and embedding DEI into the healthcare working spaces and cultures. Specifically, we will discuss encouraging equal representation in hiring and promotion processes, providing diversity and inclusion training for employees, implementing flexible work arrangement for women and families, offering mentorship and sponsorship programs, encouraging open communication and creating a safe space for diverse perspectives, celebrating and promoting the achievements of diverse employees, and evaluating and addressing unconscious bias in policies and practices. Our warmest welcome to you all for being with us today and joining us from many different countries. Dr. Wala, I start this session by handing over to you in your role as board member of the Arab International Women's Forum to deliver few words, please, of welcome on behalf of the AIWF board. Dr. Wala, over to you.
Thank you, Yumna, for the introduction. Good morning, good afternoon, everyone. I'm delighted both as a proud board member of the Arab International Women Forum and as the global influencer lead for Pfizer, and having the privilege to chair Pfizer Women Resource Group to be with you today in this second session of the exciting series of virtual panels jointly hosted by the Arab International Women Forum and Pfizer under the theme DEI by Design, Women Leadership and Legacy in Health. For over a decade now, Pfizer and AIWF have been partnering together. Pfizer as a platinum partner, corporate partner of a leading development organization as AIWF, based out of London, yet with a very strong footprint in the MENA region, alongside other well-known corporate global sponsors like PepsiCo, PwC, to name a few. So in the last 2 decades, AIWF programs have been focused on women empowerment through economic inclusion, education, entrepreneurship. And today we want to discuss more the importance of women empowerment and the health science, practice, research, innovation, and the growing role of women in the STEM industry more broadly as key advocacy tracks with which AIWF has been deeply engaged over the past few years. Across industries, and we will hear more from the fellow panelists today, but across industries, female representation in the healthcare sector diminishes considerably up the leadership ladder, with women accounting only for 19% when we reach to the C-suite level, executive level, etc. And in the healthcare industry and life science in general, we can celebrate that we're making progress globally. At manager level, at director level, globally, we've seen women increase their representation by nearly 50%, which is actually an incredible achievement if we compare ourselves to other industries. Yet, we need to see more progress. While we celebrate this one and to see positive change happen. And so for that, even if we're making progress, we should not take off our foot from the pedal. And so we also had the pandemic coming up, and we are 2 years in the pandemic, and the World Economic Forum predicted that COVID will take us back and have a 30 years detrimental impact on women gender parity. And we know it as women, but also our male partners that could be with us today, that depending on the environment and society, there could be a disproportional division of household and childcare responsibilities that existed pre-pandemic, but that was exacerbated with the homeschooling and full-time childcare that we had to take during the pandemic. And this was often at the disadvantage of women career opportunities. So now we're back, and women are eager to go back and contribute. And we will discuss more today on all the winning strategies that we need to see happening and embraced in the workplace by organizations that want to attract and retain talent, embracing the winning strategies that we will be promoting around flexibility, remote working, and providing more support and material resources for healthy work-life balance. And this is a perfect reminder of the theme that we're celebrating with International Women's Day as embracing equity. So with that, I want to take that opportunity on behalf of AIWF and Pfizer to welcome you all, and welcome also our guests that are taking time out of their busy schedule. I'm personally looking forward, together with the board of AIWF and Pfizer leadership, to working in collaboration and in dialogue with all the stakeholders with us today to support and empower and recognize women in leadership, and see how we can together pave the way for more representation of women at all levels, and pave the way for the next generation of women scientists, practitioners, researchers, and innovators. Yumna, thank you for having us, and I hand over to you.
Many thanks to you, Wala. I now take the opportunity to introduce our speakers, and we are most grateful to you for taking time from your busy schedules to be with us today and share your insights and experiences in this discussion. Dr. Naima Al-Qasir, WHO World Health Organization representative in Egypt. Dr. Naima Al-Qasir is from Bahrain and has been appointed WHO representative in Egypt. She was formerly the WHO representative in Sudan and in Iraq, having joined WHO in 1999 as senior scientist for nursing and midwifery in Geneva. Prior to joining WHO, she was regional advisor for reproductive health and family planning at UNFPA from 1996. And she also worked at the Ministry of Health in Bahrain. Dr. Naima graduated with an associate degree in nursing in 1978 and obtained a doctorate in nursing science in women's health from the University of Illinois, Chicago. Dr. Al-Qasir was the first Arab to receive an honorary award of Doctorate of Science from Glasgow Caledonian University in Scotland. Dr. Hanan Guefel is the Dean of Applied Health Science Technology College at Misr University of Science and Technology in Cairo since 2020. Dr. Hanan is also a medical physician and a consultant in the field of women's health herself, having earned a diploma from the European Society of Breast Imaging, Vienna, Austria. Dr. Hanan holds a Bachelor of Medicine and a Bachelor of Surgery from Cairo University, and she's a proud and longtime member of the Arab International Women's Forum. Dr. Reem Al-Ajlouni, Director, Jordan Breast Cancer Program. Dr. Reem is a visionary public health and health economics and policy professional with a demonstrated successful track in projects design and management. Dr. Reem is currently the director of Jordan Breast Cancer Program and previously worked as the management specialist for population health projects at the USAID mission to Jordan, a national professional officer at UNICEF, and an assistant medical coordinator at Médecins du Monde, France. She holds a master's degree and PG diploma in health economics from University of South Wales and a bachelor degree in pharmacy from University of Jordan. Dr. Wala Alami, AIWF board member and global influenza lead, Pfizer. As the global influenza lead at Pfizer, Dr. Wala is responsible for Pfizer's mRNA-based flu vaccine program. Prior to this role, Dr. Alami led the hospital business across Europe with focus on UK and 14 Western European countries. She was recently appointed as chair of Pfizer's Women Resource Group, a group dedicated to catalyzing efforts to more equitable workplace for women at Pfizer. Prior to that, she was the Africa and Middle East chair of Pfizer's Diversity, Equity and Inclusion Council, leading Pfizer's efforts to champion key initiatives promoting diversity and inclusion in the region. Dr. Wala is a board member of the Arab International Women's Forum and also a proud member of the Healthcare Business Women's Association and was awarded the HBA Luminary Award in 2022. Thank you very much for your time. And Dr. Wala, I know that you will be attending only the first hours. So thank you very much for all our speakers. And to launch our session today, all speakers have been asked to introduce themselves and to share a 4-minute response to a key starting question, starting with you, Dr. Naima. So what is DEI in healthcare and why is it important in your part of the health sector and in your own working environment? Dr. Naima, over to you, please.
First of all, happy Women's Day and happy Women's Week and happy Women's Year and happy Families Day. That's my start. It is an opportunity, and I would like to thank the International Arab Women Forum for inviting me with the Pfizer and all the organizers for having this opportunity to speak. Diversity, inclusion, and at the same time, equity are key that has been for me as part of my growing up. It has been a challenge, but for me has been an opportunity. I have grown up. My name is Naima, gift from God, firstborn for my parents, and people who went to tell my father that he has a baby girl, embarrassed. My father treated me more than having a boy, as they say it. So that's the entry into life of this life. Second, very close as my childhood, closely working with, closely being cared with my brother on equity basis. I never realized what is gender inequity until I got into the university. So that's one thing that comes to my mind immediately. I am from Bahrain. Very proud to say that one of the opportunities that I have had always has been from the equity lens. And because we are in Bahrain, we had diverse communities from different cultures, from different countries. And that's, again, inclusion has been there. Now, growing up, what is now today, I'm in a proud institution, which is World Health Organization. People who are following the World Health Organization, and you mentioned that I was in Geneva. Yesterday, I was reflecting the first ever forum that was celebrated Women's Day, 8th of March, was during 2000, which is my year, the first year in Geneva. That year, we had created a group called 50-50. The 50-50 was to bring the rights aspect to both men and women, to give opportunity with gender equity lens. By then, I had already served 5 years on the IPPF gender panel, International Planned Parenthood panel, before joining WHO and UN. So already I had brought that perspective that we need to look from really empowering both, positioning women for a reason, because there were very few women in decision-making.
I think there's a connection issue at Dr. Naima's side. Okay, we can wait for Dr. Naima to rejoin or fix the connection issue. Okay. Yes, Dr.
She's okay.
Also advocating for the voice of the girls. Just on a short short message. Today, we have great opportunities. The COVID-19 has brought greater opportunities for the woman's voice. So for me, from family to my country institution, I have seen the growth. I have seen the positioning, leadership, women in leadership. COVID-19 proved that health sector really suffered at the service. Yesterday, or I was sharing with some other entities, that 70%, almost 60-70% in the health sector are women. 90% are nurses and midwives. They have not been in the decision-making, and they have been subjected, COVID-19 proved, more to the violence and more to the abuse. So that abuse and violence is a challenge. However, we can celebrate that there is a realization and there is a respect for the what I call rights-based approach to bring both women and young voices, but at the same time, give the opportunity under the gender lens for the men. So solidarity here is critical. For me, family, environment, institutions, schools, university, where I had great mentors, I'm indebtful for him. And most probably, I want to give my last sentence. When I started in my country, Bahrain, I learned the empowerment, the powering to be with the civil society supported by men. So that's another angle I would like to bring. However, today we are seeing this needs to be scaled up, bringing the young boys. Thank you very much. I think I completed my 4 minutes. No?
Thank you very much, Dr. Naima, and thank you very much for sharing the insights and the beginning, since the beginning until the current posts. Thank you very much. And Dr. Arim, over to you.
Okay, thank you very much. First of all, thank you very much for having me in this very important discussion. It's my pleasure to join all these career women, both the panelists and everyone who's attending with us. Thank you, Yumna. Thank you, Louise. Thank you, everyone at the Arab International Women Network and Pfizer. And yesterday was the International Women's Day. So I hope its vibes continue with us all of the year. And my salutation to all of the great and strong women everywhere who are continuing to pave the way for us to lead the way and to overcome all the stereotypes related to women in leadership positions. For me, when you ask me about diversity, equity, and inclusion, what does it mean for healthcare? I don't differentiate health from diversity, equity, and inclusion. Actually, although there's a recent, let's say, focus and importance is increasing for DEI in our business. Actually, healthcare is DEI from the beginning. They are not disconnected. Actually, healthcare is inclusion, is equity, and is diversity. So because health is a human right, I believe that health is a human right. So that's why just wanted to make sure to reiterate the message that they are not different. It's the same when we talk healthcare, it's equity. What does it mean more importantly in health? Diversity is how to respect the range of human differences, the uniqueness, all of our different characteristics. And I think this is where patient-centric care and all the global direction toward more patient-centric care came. It's from diversity. Equity is how to close all these gaps around us to ensure fair opportunities and to ensure equal access to everyone. When we say universal health coverage, when we say health for all, I think it comes first from the equity lens. And inclusion is creating respectful and dignified environment, both for health workers and for our beneficiaries. So when we look at DEI, I look at it from both perspectives, the perspective of the health workforce and the health care environments, and also about beneficiaries, about our end users, our patients. At the end of the day, with healthcare, everything we do in healthcare, whether it's health service delivery or healthcare management, programming, whatever, prevention, curative care, tertiary, primary, everything we do is to improve health outcomes, is to improve the lives of others. So it's about the health environment or the work environment itself, but most importantly, it's about our beneficiaries and our patient we are serving. So that's what DEI means for me in health. Why it's important? Because I think lack of equity and lack of diversity in healthcare translates into a lack of efficiency, translates into higher costs, translates into increased barriers and decreased access, which means more setbacks. It's very it's great to see all the recent social justice movements, to see the increase in social accountability through having now the social media platforms and through having people speaking up. It's great that this is taking us more movements and advancing DEI in healthcare. But again, back to my first point is healthcare is a human right and DEI is integrated, or it's the same as the same values of healthcare. And that's why it's important. It's important because you are improving health outcomes for people, for communities. You are serving people in this. I think this is in a nutshell.
Very well aligned, Dr. Reem. So the DEI is the base of the healthcare. Thank you very much for sharing. Dr. Hanan, over to you, please.
Thank you very much. Good afternoon, everyone. I am honored to be inviting among distinguished guests to take part in this very important discussion of embedding DEI, diversity, equity, and equality in healthcare, and highlighting issues regarding women's representation and inclusion in the healthcare industries. Let me first, I would like to introduce myself. I am Dr. Hanan Guefel, a medical physician based in Cairo. I am Egyptian, graduated from Cairo University School of Medicine in 1983. I am a wife, mother, and grandmother for 3 children, wonderful children. I have been serving women through healthcare for over 25 years. I have been also a member of the Arab International Forum since 2003 and had the pleasure of attending a meeting chaired by Her Majesty Queen Rania of Jordan in 2005 at the residence of the Mayor of London. That meeting has been an inspiration to me on both a personal and professional level. I'm looking forward for a delightful discussion with all our exceptional guests. Let me first revise again for our audience, even what is DEI. Diversity is the appreciation and prioritization of different backgrounds, identities, experience collectively and as individuals. Equity is the effort to provide different levels of support based on needs of an individual or group to achieve fairness in the outcomes. Inclusion is a state of belonging when people of different backgrounds, experiences, and identities are valued, integrated, and welcome as decision makers, collaborators, and colleagues. So let me bring a statement. I believe in it that people are the backbone of healthcare system, even in the era of artificial intelligence. Good people are not identified by gender or religion or age. Any organization succeeds based on people and technology. And we have something in leadership or communication called organizational culture. Collection of values, beliefs, stories, and many more that create a common identity and feelings of community among employees. And every organization has unique culture, reflections of deeply held values and beliefs of top management. The demographic of the workforce have changed. People travel from place to place, people migrate, and today talent is a key for successful business. DEI has the potential for better business, and it is also make good business productivity and profit. This is why HR practice is vital to better and not the need mostly for the needs of employees and customers as well. Companies and organizations that fail to take proactive steps to make DEI a priority may struggle to meet their business goals. I have to say that people from different backgrounds allow ideas to flow. Female also leaders are significantly more likely to use a democratic style of leadership, as leadership is a very important aspect in businesses nowadays. I think by this, I might add benefit of DEI. It make better performance for the company, add integrity to the team, put active give opportunities to all, and encourage innovation and decrease turnover. Thank you.
Thank you, Dr. Hanan. And definitely companies which embrace D&I, they have higher tendency to achieve their goals, as you said, very well aligned. And I now give it over to Dr. Wala, if we can please hear your insights on the D&I in the healthcare.
Sure. I think all the guest speakers have covered it, very well. I don't think we, in the healthcare in particular, where when we speak about patients, women represent 50% of the population. When we think more globally about all the patients, all of them are different with different backgrounds. So that speaks to the importance of diversity. We cannot be efficient. We cannot really add value and impact the patient, the life of patients we serve, without embracing diversity to be able to adapt our approach to all type of patients. I think inclusion, Dr. Hanan mentioned it very well. Inclusion means that we consider diversity and we really walk the talk with it. And that reflects on how we take all the insights and learning from diversity, and equity is really takes it even to a broader level in the healthcare, because you want everyone to have access, to be considered and to have the right to have access to the healthcare regardless of their background, gender, religion, etc. So there is no there are a lot of spaces, and all spaces require D&I to be front and center. But I think when it comes to healthcare in particular, there is no healthcare without D&I. So I think all the speakers mentioned it very well. I just wanted to maybe build on all the points.
Thank you, Dr. Wala, and thank you for all the insights. Dr. Naima, you thankfully shared that women make up nearly 70% in most healthcare systems, and 90% are nurses and midwives, and they are keen on making differences in the deliverables. However, they're not in the decision-making, they are not around the table. And I'd like to ask you, what do you see as the greatest challenge for diversity and inclusion in your part of the sector? So what is the challenges, Dr. Naima?
One of the things that I would like to go back to the rights of health and human rights that has been came across. In the health sector, we take, especially the health professionals, we take the oath that we will serve everyone, human beings. So this is the first thing, that's the base, that's the value base. The challenges is the translation and how to avoid the stigma. Here we are talking about two voices in decision-making. One, the voice of the personal care in this regard, since we are talking about the woman and women's health, how much the woman has a voice, or the young girls have a voice in terms of the decision of how their care should be. This is where we are finding, and we always, historically, we used to call it medicalization of the healthcare. Medicalization, what do I mean? For example, the female genital mutilation, which is a harmful practice. We have the increased cesarean section. I'm serving now in a country that cesarean section is the highest level, it's like the third. This is a violence against the woman. So this is one thing, the voice needs to be there. When we talk about the equity voice, usually the woman seen is just to accept the care and not to have a say how to shape it. When it comes to the provider of the care, in the oath, the diversity, inclusion, and equity, it's under the whole right approach that we will serve everyone without having any kind of distinction. Where is our issue? Is the way we have been raised and the stigma we come. For example, the issue about now I have served in the conflict countries, 6.5 years in Iraq, in Sudan, 5.5 years, in Egypt before 2010 to 2014. So I have seen the conflicts, the movements in Libya and Yemen. And I have seen always the women have been the most vulnerable. And when it comes to the health sector, to the decision-making, they have been having the least voice on how the service should be and how their inclusion should be. So this has been a challenge. However, it has been also an opportunity to really bring this to raise it to the level that there should be an eye to this. The inclusion should be happening. Not only the political decision-making, but for us is the health. Very well said earlier by my colleagues here online, Purarim and others, that we need to have the inclusion, because if we do not have a healthy person, here in this case, a healthy woman, we will not have a healthy family, we will not have an economy, we will not have I usually call it health as a bridge for peace. So what's happening with the voices of nurses and midwives, who are the majority of the sector? We always call that they are the pillars of any service. The service is not only hospitals. We are talking about communities, schools, workplaces. That's the prevention of the disease. We talk about promotion of the health. Only less than 10% of the population need hospitals and medicines and diagnostics. This is one thing, again, that's the voice of decision-making. When it comes to the healthcare provider, in this regard, the nurses and midwives, they are having a voice. For example, how can they really reduce the agony that the woman and the young girls go through taking their oath and practicing it? I'm very proud to say that in Egypt, the last 9 months, we have moved to look at the oath, to look at the ethics, code of ethics, and how is it translated in bringing the voices of the nurses, midwives, women, and the girls at the line of the decision maker. When I said proud, because now we have almost 12 high-level, minister level, head of the Parliament for Health, head of Senate for Health, head of Egypt Healthcare, head of Egypt General Authorities for accreditation, all signed that they are committed to protect the woman, committed to bring the voice to the decision making. So the challenge can be turned. One last group that always we forget to mention is the refugees and displaced and the migrants. This is very critical group. In our region, until very recently, we were having the highest host countries in our region hosting the refugees, whether it's in Jordan, whether it's Lebanon, in Egypt. In Egypt, it's less visible, even though they have 9 million between refugees and migrants. Less visible, why? Because there are no, I always say this is a credit, a plus for Egypt. There are no camps, there are no concentrated places. They live among the people of Egypt. However, the services and voices needs to be done. This group, more and more their voices are coming forward in the decision-making table. I'm talking now about the sector of health. And that is something that I'm seeing the change. Maybe I'm comparing of where we were when I was serving in Iraq in the year of 2003, and where are we today when I'm serving in like 20 years in Egypt, and what's happening in our countries. So diversity, inclusion, equity is actually for human being, is part and parcel of our oath that we have taken. It is part of the United Nations human rights, is part of the World Health Organization's constitution when it was formed in 1948. Whereas the challenge is the understanding, the reduction of the stigma, the cultural background, the way we were raised, and what I call in the health sector, the medical model, the patriotic model that took place, and most importantly, historically, majority men deciding of what the health sector should look like. And I call it health, not medical. It was medical, traditional. If we take the last 34 years, what we call the best practice developed medicine is actually medical. It is not healthcare. We are now in the transformation. We are now in the transition. COVID-19 proved that the best health systems, quote unquote, in very well-resourced countries could not function and fail. Why? Because it was medical model. It was not a health model. So the language, even us as healthcare professionals, we need to change the language to distinguish. We are protecting the health of the people. We are protecting them not to get sick. And sickness means medical services. Health means the totality of what Dr. Reem was talking about, universal health insurance. So I think this is where we are having the challenge of the stigma, the challenge, the way we were raised in different countries, the challenge of the media. Dr. Hanan mentioned about the digitalization, artificial social media today that can be infodemic, we call it, bring a wrong perception. The challenge of the TV, how we are portrayed as women, how we are portrayed as young girls, that we should be followers. We should be just saying yes. So this is changing, and we have a challenge on how to change it positively, where the woman voice, and I started young boys, young men voice. Maybe I immediately listening to you, I reflected on my first 40th anniversary for International Planned Parenthood Federation. I was asked to speak about women in decision-making and how come the women in the Islamic world are undermined. My response was, it's not the Islamic or Christian or whatever faith, it's the way we have been raised, and we need to look at the young boys, young girls from the kindergarten working with their families to bring the gender equity. So it's a whole transformation, it's a whole of rethink on how we see what do we mean by human rights. Once we say this is the rights, respect, trust, equity, everybody to be treated the same, the diversity and inclusion automatically will happen. But the minute we make it a parallel, this is my view, we are going to lose it again. If we say human being, regardless of their status, refugees, migrants, host communities, displaced, regardless of the color of eyes of this, then it is a human being, must be treated. The measurements is 1, 2, 3, then we are respecting a human being and we are giving the full service. This is at the human being level. At the institutional level, the policies to ensure that the voices are respected, whether they are managers or they are providers or an institution serving a community intersectorally with others. So again, I'm bringing the word of opportunity, and COVID-19 has opened up a lot to reflect our values, to reflect our assessment of what is the good and what is the worst, and how can we move towards the goodness, taking the, if you want to use this session theme, the diversity, the inclusiveness, bringing the voices around the table. Always they will tell you, don't bring everyone, it's too much, you will confuse. My experience has been, it has brought more commitment, more ownership, more change, positive change. And I can confidently say, thank you very much for this opportunity.
Thank you very much, Dr. Naima, for sharing your efforts. And I took a note here and I changed it several times as you speak. So first I said girls have a voice, and then young people have a voice, and then I concluded by what you thankfully shared, human beings. All human beings have a voice and they should be heard and included in whatever organization they're working in. Thank you very much. Dr. Reem, you shared with us in the first part of the panel that D&I is the base of healthcare. So it's the base for everything and it stems out of it. So can you please share with us the challenges, the greatest challenges for diversity and inclusion in your part of the sector as well?
Yes, sure. Thank you, Yumna. And thanks to Dr. Naima. Actually, she elaborated very well on all aspects of, or the main aspects of the challenges. I think back to the point when you mentioned that 70% of the healthcare workforce are women or females, while a very low percentage of this workforce is in leadership positions. I think what we see globally, all the global direction, all the strategies and policies and all these high level documents that talk about diversity, inclusion, equity, closing the gender gap, bringing more voice to people, there's an increased focus. But unfortunately, this focus is not matched with a progress on the ground. There's a lack between, or there is a lack of translation between what's being discussed in high level fora programs and being articulated and strategies and policies, and between what's being achieved on the ground. Part of it, I can say, is the unconscious bias that, as Dr. Naima, we were raised like this. It's not only in our part of the region, it's in general, the unconscious bias for the women themselves and the unconscious bias of the systems and the cultures and the environments around women. So we need to believe in ourselves. We need to believe that we are game changers at the first place, and then everything will come into place. This when it comes to women leadership and the lack of women in leadership positions. I think it starts by us. It starts from within. The second aspect, challenges related to DEI and healthcare in general, I think worldwide in our region and low middle income countries or in high income countries, health systems are becoming more fragmented, more medicalized, and more bureaucratic. As also Dr. Naima mentioned, it's not medical. It's not only about health services and what health technologies I provide for you as a patient. It's about the health in general. And when we talk about health, an advocate for primary health care and preventive health care, unfortunately, in our part of the world, and even in developed world, it's more toward curative care. We say that we focus on primary health care. We have international and national commitments to improve primary health care, but unfortunately the gap is still very huge when it comes to preventive care and when it comes to primary health care. And this is my part. I'm leading a program that it revolves in this area, primary healthcare, preventive healthcare. Unfortunately, still there are challenges related to access, related to availability of services, related to treatment, but the challenges related to accessing preventive care is even more, because also when you look at different insurance plans, usually prevention is not part of these plans. So there's more discrimination against this, and there is a focus on primary health care, but unfortunately only on paper and only in venues of high level discussions. When it comes to healthcare, we need to speak to ensure that everyone is involved. Everything in health is bottom up and top down. So it's not only policies and procedures and high level strategies, but also you need to hear from the people, you need to hear from communities, you need to hear from the healthcare workers. And I think still there is a gap when it comes to including and involving everyone. In general, lack of the holistic approaches, lack of looking at health as there is the social determinant of health. So as I mentioned, as Dr. Naima mentioned, it's not only about a treatment, it's not only about the medical side, but we need to look in a holistic way. We need to understand that health is beyond only absence of sickness. It's the well-being of people, the well-being of individuals, the well-being of communities. So I think in these areas, we still have gaps. The other thing is the economic gender gap. A recent report I read for the World Economic Forum, we need, with all the focus, with all the renewed commitment on closing the gender gap and closing the economic gender gaps, we still need more than 150 years to close these gaps. So we have a lot on our plate to digest and to understand. We need to understand more what works and what does not work, and we did not reach this stage. We know that it's important, but we don't know how to translate it into action. So this is my point of view, and over to you, Yumna.
Thank you, Dr. Reem. And I too think that the essence of the core essence of D&I is to have bottom-up and top-bottom discussions so that everyone is included. Thank you very much for sharing that. Dr. Wala, I know that you will have to leave, but before leaving, if possible, to get your insights on the key challenges. I want to share with you here today something that I shared with Dr. Wala when I first met her. I couldn't pronounce the name. I didn't know it was a lady's name. And based on the title, I thought she was a man. And when I met her and found she was a female in this leadership position, I was very happy, and I respected a company that would give an opportunity to females. So this is something that I shared on the first day that I met Dr. Wale, and I'm happy to hear your insights, Dr. Wale, on the challenges on diversity and inclusion.
No, thank you. Thank you, Yumna, for the question. And you know, the point that you mentioned related to my name, and I'm not sure if you wanted me to focus on gender diversity and equity inclusion in particular or just in general, but I just wanted to say that, you know, I think that goes to the bias and the conscious and unconscious bias that we have in general, regardless of the societies. Because initially when I first joined, you know, the Middle East, I'm originally from North Africa, and just like I think Dr. Naima, I didn't expect or know anything about, you know, gender diversity before I started, you know, working. And actually, Yumna, to your point, what brought me into the women in, you know, empowerment, and really the passion for diversity, inclusion, and really at the very broad definition of diversity, equity, inclusion, and not only gender, is to see the power of unconscious bias, and also to see how you can make bridges by using your voice. Just by using your voice and having the conversation around the challenges, because oftentimes, and that's one of the challenges, we think it's clear, it's taken for granted, and we underestimate the importance of having the conversation, the difficult ones, to speak about, you know, the impact that the lack of diversity inclusion can have in general on people. But when it comes to healthcare, it means the well-being, as you mentioned, Dr. Reem, but sometimes, you know, impacts on their life as well. So that's, I think, one of the first challenge. The second one has to do with oftentimes diversity, equity, inclusion being considered as a good to have, and so not enough focus and prioritization of diversity, equity, inclusion, because we think there are more important things that we have to work on. And diversity, equity, inclusion is a good to have, does not drive business, does not drive political agenda, does not drive progress in the society, etc. But we just have to go back now to the facts. Diversity, inclusion, equity, and inclusion is for and center in all fields, and we are now, you know, seeing it more and more. I think the challenges as well is it takes time to make progress, and we don't want to, you know, give up. So even if we don't reach the progress we want to see in our time, small steps take us to, you know, like new frontiers, and we should all be engaged as we think about the present that we want to live in, the impact we want to have to the society, and more importantly, the future that we want to shape for the future, you know, for the next generation. As moms, as dads, as brothers and sisters, we just want to create a better environment, and that's personally part of the purpose that is driving me in life. So I can continue on and on the challenges, but I'm just Dr. Naima. I love to focus on opportunities, because once you shift the mindset, you really think about how do you make bridges, you know, with the other, you know, the other side, and how to overcome obstacles. So there are obstacles, but I love to think about how we can turn these into opportunities and create the bridges that will take us to a better, you know, situation. And we are making progress. I think it's super important to recognize that there is progress in all countries, all regions, and all diversity and equity inclusion dimension. So that will be my 2 cents, Yumna, before I leave. But I wanted to say thank you for having me. It's been an honor. I shared in the chat that I've been taking notes of the pearls that have been shared so far by the panelists. So lucky all those of you that will be able to stay until the end. But unfortunately, I had conflicts at this time, and I will need to leave. So thank you very much for having me, and enjoy the rest of the discussion. Inspiring.
Thank you very much.
It's a pleasure.
Thank you, likewise. Bye-bye. Bye, everyone.
Thank you, Dr. Wale. Thank you for your time.
Bye.
And
thank you. Bye-bye.
And definitely D&I is definitely not good to have. It's critical. It's far front and center in every field. So thank you very much, Dr. Wala, for sharing. Dr. Hanan, if you can please share from your side the challenges in diversity and inclusion and share with us the insights, please.
Thank you, Yomna. I think after Dr. Naima, all it say, yani, she said it all. And Dr. Reem and Wala, thank you so much. I think the greatest challenges for diversity and inclusion are limited opportunities in research leadership. There is a lack of diversity in healthcare academia. However, there is a lot of women in academia, but for the leadership position, there is lack for women there in like university presidents here in Egypt. We have once a university president, but we didn't have it yet. I'm not sure about Bahrain or Iraq or Jordan. Do they have a president? Yes. Also, the overwhelming cost for healthcare education, because if we need women in healthcare, so we need to give them chances to join nursing school, school of medicine, and I think the cost of this education might be a barrier for women. I don't have anything else to say, but definitely social media raising awareness about opportunities, because young people and particularly young women in their early careers, they need mentoring. They lack opportunities, how they reach to an opportunity. Like I had an opportunity to meet the Arab International Women Forum that helped me in my early career. Like Dr. Naima, she's now heading a very important organization worldwide, which is the WHO in Egypt. So we need many more examples like Dr. Naima, Dr. Reem also on the top of screening program in Jordan. This is a great achievement, and we need to see others and more of women in such key places. So the challenge are maybe like Dr. Reem said, now with the economy, that would be challenging. However, COVID-19 provide a lot to the human being. He also took a lot, but also there was opportunity within COVID-19 pandemic, which is the distance learning. Now, online distance learning, now women can be educated, can learn language, can learn a lot of things where they are sitting in their home. So this also something important. I think if we use it, distance learning, there is like a prestigious universities like Harvard and Stanford. They had the EDX and Coursera, which are a very prestigious platform where everyone, not only women, can learn and can educate themselves about everything. I think these are the only challenges there. Maybe because of the women, they have to take care of their family, they have to take care of their parents even. So they are multitask, you know. Women are loaded with a lot of things. If we provide for them a place where preschool child, the woman can put her babies there and she can focus on her work. Also transportation, also equality in salaries, because if she earns the money, she can provide herself with a good help. I think, Yomna, these are some of the challenges in my mind now. Thank you.
Thank you, Dr. Hanan, and definitely many opportunities. Thank you very much. And speaking about opportunities, I'd like to ask you, Dr. Naima, what are the best practices that you've implemented or observed? What are you're most proud of in terms of the initiatives that you've steered and the changes that you've implemented?
You know, this question, when I was reading it, it comes to my heart, and I was thinking which success I should say. But the belief of positioning the woman and young men. So I'm having, first, when I said, before even joining, working with the civil society, teaching the woman voluntarily on how to read. And it was mahwa al-ummiyya, okay? As a young, even not yet graduated. But immediately I took, and instead of teaching Alif Ba or Abjad Hawas, it was about women's health, how to take care of your health, but in a simple way. That was even by ACPAD, it was recognized. Then my best, which I see, because it took me a long way, I talked about 50-50 as a volunteer in WHO in 2000, and now we are having policies in place, institutional, where our voice was, how can we support the woman within the institution to be able to function and deliver at WHO? There were very few women leadership. And how can we have a creche? That's another success. My most success that I really learned also, having interns. Internship, when I was in Bahrain, I would take a young high graduates and they will work with me. Some of them, I'm proud of them. Now they are in a high level. When I went and worked in Geneva, I didn't have a staff. Majority were internship. Today, most of them are in a very senior positions. Now, to me, these are the groups that I'm proud of. Last 2 years, I have been working with the youth here in Egypt, mainly for COP27. So proud when I say youth, and it has gender lens equity. So I have the young men and the young girls. They are all not necessarily only a medical profession, that is nursing, pharmacy, and this, but also veterinarian, media persons, engineers. And it has been a culmination that I see. It's something that we need to put the seed. We need to grow it. And it's not always the issue of the money. That's some of the things that we think. We need to get the fund to position the woman. We need to do the fund to do this. No, it's the belief, it's the institutionalization, it's setting the policy, it's making sure how we can build sustaining it, not to be dropped. And more importantly, what I call tracking. I usually use the word tracking instead of monitoring and evaluation. This is where you can see the change. Progress has been made. Whereas these are some of the, the approach that you take. Yes. Also, we talked about here mentorship and coaching. There is a mentorship, there is a coaching, there is a role modeling, there is a holding hands, and there is sometimes to walk and step back. I'm very proud that here, when we did in the COP27, we had the first global voice of the youth. Majority, I have to say, sometimes you need to make the not equal, but sometimes equity, where you want to have the voice of women more heard, where for the first time, they had the global forum for the climate change and health, taking from the health angle totality and not only from the medical. Why I'm very proud of this experience, because it's now trickling. It's trickling in Egypt, it's trickling in the Gulf, it's trickling in different Sudan, North Africa's countries. And that is, again, bringing the rights-based approach. More importantly, the mentorship, the coaching, the hand-holding is also really being conscious of where are we falling. Why did we fall? Why didn't we continue to have this nucleus that we worked on? Why didn't we? What happened that suddenly things stopped? Where was the communication gap? It's not only WhatsApp. I sent you a WhatsApp. I sent you an email. What is the response? And where are what I call the human behavior? So when we talk about the stigma, where is the human behavior? When we talk about the undermining, what happened, why it was undermined, that requires not only talking about it at the same time, which I always tell my team, wherever I have worked, but also to document it and be observed. One of the drawbacks I see recently, I'm comparing between decades, because I always say I'm coloring my hair, between the decades, from young professional to now where I am saying before in my DNA, not DEI, in my DNA, we have been taught whenever we do something, whether in the family or my institution in Bahrain, I had minister who would tell us, okay, what did you learn? Immediately. We celebrate, we have chocolate distributed, and I say, okay, sit now, critical input. What did we learn? What I am observing recently, whether with women movement or with the youth movement, we do not want to reflect on lessons learned immediately. And that is something I'm trying to see, how can we bring it? Because we are running for success. So sustaining the success elements require, we need to look continuously about mentorship approach. More importantly, investing, what does it mean investing in terms of time? Money, in terms of the reward. Sometimes investment is little, but the reward is high. And I can give evidence in our countries, whether it's Egypt or Sudan or I would say, maybe I'm Bahraini, I'm not biased, but I will be biased. I would say my country invested from the policy. One of the things they said, al-athar. Al-athar is impact. But what happened? Every 3 months for the last 2 decades, followed what policies implemented, translated, transformed, and where is the outcome? Today, the outcome, you have the woman, not only president of the university, you have more in the deans as colleges, you have equity. I will not say it's more women than men, but also you have the more in the decision-making as ministers, as the undersecretaries, as directors. This is something we would like to see that's actually sustained, invested in. And Dr. Reem, you are an economist. I'm talking about the value-based return. It's not the money return, the value-based return, because your investment from money-wise could be minimal, but the outcome and the reward is highest to protect the human being. In this case, we are talking about from health aspect. You will not make money, you will not have development, you will not economically be developed unless you are having healthy population. In this regard, now we are talking about not only healthy population, but also healthy young girls, healthy men, young women, men, so they can also contribute. And these are some of the 3 messages I wanted to give: is sustainability, having lessons learned, reflection. One of the weaknesses we have sometimes, we think we bring new institutions that will be better. When I was looking at Arab International Women's Forum, I reflected. I was the founder of International Council for Women's Health. I was a student. I'm thinking, where is it now? Where is it now? That was international. And those days we talked about the Arab Women's Forum or Women's Council. So now today, these are some of the things we need to build: institutionalization. And that's why I gave the example of my country, Bahrain, institutionalization. Finally, now I am in Egypt. Now that we are on this celebrating this day in United Nations, now they are discussing about CEDAW and what is the progress made. What Egypt has presented: investment in young girls. Investment in young girls, focusing on education. A lot of investment happened. The review has shown where are the gaps, the multi-million dollars that has been spent over the past years. Where is the outcome, as one of your ministers said? Can we look, how can we improve the indicators? Why we have not improved the indicators? So this has led to really come with a pragmatic, realistic, with investment case to put resources, whether it's money, logistics, civil society, social contracts, social movements, but at the same time see rewards and say we made a change. And that's what I call the tracking. I would like to really, this opportunity, I mean, the more I speak, the more I think of examples to give, but I would like to give the floor back. I'm not sure that I talked about reverse mentorship. Reverse mentorship is one of the things I believe, and this is something also, to me, is something best practice, if responding to your question. What do I mean by reverse mentorship? People whom I mentored, younger than me, today I go to them and say, can you be my mentor? I have this issue. You are a younger, what are you advising me? What shall I say? What should I behave? And I believe this reverse mentorship should be also strengthened. This shows the lens of equity, lens of respect, lens of trust, and then at the same time, lens of solidarity. And that's something that we can also have look at it from a woman perspective, young girls perspective. So it's not always top down, but it's also on the equity lens, is equal voices, and at the same time for the betterness that should happen. That's something that we need to learn together. Thank you.
Thank you very much, Dr. Naima, and I hope all the interns that you helped before would pay it forward, because this is how the cycle continues. And thank you very much. And took note about the tracking, and it's important to evaluate the progress and to evaluate the resources needed for future more progress. Thank you very much, Dr. Naima. And Dr. Reem, I would like to hear your insights as well on the best practices so that you've implemented or observed.
Yes, sure. Again, thank you, and thank you for Dr. Naima. You, yeah, Dr. Naima, you nailed it in all the questions. But yeah, actually, Yumna, back to when we talk about healthcare is about the health workforce or the healthcare environment, the working environment, and I never forget the patients, the health systems, all the health outcomes we want to achieve. For both, the best practice is to be inclusive, to include everyone, to hear all voices. Everyone has something to say, and everyone has perspective to be respected. So when it comes to work environment, let's say, creating healthy work environments for healthcare providers and for healthcare managers to share, to explore ideas, to brainstorm together. And this is what we have created a work environment where everyone is comfortable sharing and everyone comfortable of giving feedback. And this really works. It advances the work environment itself, the culture, the morale, and consequently, it advances everything you do. It improves remarkably the outcomes you're trying to work on. With health programming, always know your baseline. Always understand the context you're coming from. Always understand the beneficiaries you want to serve. Then design your programs, include them while you're designing, and set metrics for success. Always have indicators, always have monitoring and evaluation, always pause and reflect. When it comes to people, I always like to hear from them. And I'm proud that with our program at all levels of implementation and of design and of programming, we always hear the voice of women. We always solicit their feedback. We always conduct a qualitative research platforms and ways to hear from them, to make sure that what we're delivering, the way we are implementing, is valid for the community. And we're proud that breast cancer now in Jordan is positioned as a public health priority, is positioned as a community and social justice issue. It's not only a cancer working on screening, but we work in an integrated, a holistic way, where now not only during the campaigns, but throughout the year, everyone is involved and everyone is encouraged to support breast cancer early detection and to support breast cancer diagnosis and screening in its own way. So we go to schools, to universities, to banks, to corporates, to non-governmental organizations, to governmental organizations, to everyone. So to position breast cancer as a public health priority and involving everyone and hearing feedback from everyone really worked with us. Something I'm proud of is throughout my career, and still I'm not coloring my hair, I'm more or less young, but
You're young.
yeah, alhamdulillah,
I'm
due to
proud of
Dr.
you.
Naima. Thank you. In everything I do or we do, we try to give voice for women. We are not change is not easy, and the way systems and the way healthcare industry was built, usually working in silos. What we do and what I did now with the Jordan Breast Cancer Program, or previously with USAID, with UNICEF, is to involve women and to give them voice, to advocate for themselves. One of the examples is where we trained women in underprivileged community talking to them about health insurance, the importance of health insurance, the importance of social accountability when it comes to asking for your rights. And it's very nice to hear that those women, group of them, they advocated for their right in accessing health, and they were not insured. They working in the informal health sector or the informal sector, but they advocated and they sat with policymakers and they were given insurance. So this is very small example of how when you just one workshop working with the right people, delivering the right message could make change. It's a small example, but I'm really proud of, because it changed the life of someone. It changed the life of families, of women household-led families. So again, as to be inclusive, which means to include everyone, include your team, include your staff, translate evidence into action, translate policies and strategies into actions, know your baseline, build your plan, set metrics for success, continue to follow up and continue to engage people and to hear from them. It's very important, the feedback coming from the field, very, very important. And acknowledge that change is not easy. It's not easy, but we need to move on. We need to take the first step, even if they are baby steps, but steps in the right direction will lead us to have great leaps forward. Thank you.
Very good.
Thank you very much, Dr. Reem, for sharing. And definitely, change is not easy. Very proud of the change that you've driven yourself, mashallah, in the work that you're doing. And it's all based on the diversity and inclusion, including everyone, and ensuring that you're considering everyone, the patients, the employees, the teams. So thank you very much for sharing, Dr. Reem. Dr. Hanan, would like to hear your insights as well on the best practices that you've led or observed from your side. You're on mute, Dr. Hanan.
Thank you very much, Yomna. Thank you, Dr. Naima, and thank you, Dr. Reem. I really learned a lot of this subject, and I wish to invite one day Dr. Naima to speak to our university, to give them more opportunities and to let them know more about the DEI. Everyone has to take a look about recruiting and hiring in his organization. Is he including everyone? Establishing a mentor opportunity, as Dr. Naima mentioned 2 days before, there is mentorship conference usually in Bahrain, but we need to know more. We need young girls should know about these opportunities. I myself learned a lot from Sherry Blair Foundation. They give me a mentorship opportunity with the women from Iran, and she was based in London. And she took me through a difficult time when I was promoted from head of radiology department in a university, in the hospital. And she really inspired me and motivated me to make it very thoroughly and very carefully with my manager at that time. So mentorship opportunities are very well needed and much needed, particularly in the MENA area and particularly in our country, Egypt. Also, we have to promote teamwork, because teamwork, no one can go forever alone, but we all together can go for a long journey together. Also, we have to make inclusion is priority and provide diversity training and provide leadership and networking skills, because these are a very important issue. That's what I want. Also, providing technical and vocational training targeting women, and encourage work environment free of harassment, discrimination, and respectful of women, and let women work in a culture-sensitive manner. This is my wish and my desire. Thank you.
Thank you, Dr. Hanan, very much for sharing. We have a question from the audience as well. Dr. Naima, it's about the link between the finance and the health sector. And the question is, how do you think the finance and the health sector can collaborate, and what initiatives would you value? If you can please share your insights on that.
This is great because the governments, every governments, all of them, especially in our region, put a lot of money in the health of people. And usually it is not seen. People do not see it. They just ask for their rights. And I'm talking about the people, whether women, the young men, everyone. We do not behave healthy. We have a highest rate. I said yesterday in another forum, like I say in the Guinness Forum, where we have the highest rate of smoking is becoming increasing. We have the highest rate of the obesity in our region. I'm talking now about our Arab community. The women in our region are majority obese. We have the highest rate of diabetes, the non-physical activities. These behaviors, individual behaviors by us, is going to bring the 4 main diseases, causes of main chronic diseases, which is a lot of investment of money, whether it's diabetes, heart diseases, hypertension, cancer, there is mental health, which we didn't talk today much. This means cost to the medical service. So where is the relationship? And we are talking about universal health coverage, that we are talking about how the woman can ask, how they can be not paying, families, not only women, families not to pay out of their pocket to the health services and medical services, that there should be some kind of protecting them. When Reem mentioned about, Dr. Reem mentioned about the protection and the woman knows their rights on the health insurance, it's part of the protection, and that's where the health and finance come together, is where the funds, resources should become to be catering when the requirement for the medical services come. We do have for the preventive sector, which Ministry of Finance, we say Ministry of Finance need to put the money. The government should put a contribution in the budget, the yearly fiscal budget, or the every few years. So this is where the 2 links comes. I'm proud to say that I have been working with the two ministries very closely, and with the 2 authorities in different countries, whether it's health services, or what we call the payer of the service. Payer of the service can be an insurance system, or it can be government, or it can be charity. For example, in Egypt, we have the charity like Shafa Urman, like the Mustashfa Nas, and this is in most of the countries. And that's where the 2 are intertwined, is the whole behavior in the decision-making. When I said we have approached medical, traditional, Western model, it has focused on high-cost service, not necessarily with high-yield revenue value-based for healthy population. This is a challenge we have, and that's where now health insurance, and in Egypt, for example, universal health insurance, in Bahrain, universal health insurance. I have lived in Jordan, so I know also the very active measures in Jordan taken to respect human being, karamat al-insan. And that's where it comes, the juncture on how to respect karamat al-insan, how to respect the protection of the health and healthy well-being of people while investing rightly the resources. So when I brought these 2 entities together, it's looking, when we invest $1, what is the reward? If we invest $1 in for example, in giving the vaccination to the population, the reward is almost $16 to $20 of better population health. And these are the relationship between the health and finance. Now, there are 3 elements to this. First, most of our countries, the way we design the health strategy, everybody aims to protect the health of the people. Everybody aims to have better population, and they want to put the money. Where is the translation? I'm putting it in a simple word. Where is the translation? The translation, we might buy highly cost and what they call the technology, high medicine, highly cost medicine, that's not necessarily meeting the 2. This is where the society and the social understanding from persons to family to communities that we need to really understand what does it mean where we are not taking care of our health and well-being? What does it mean in terms of protecting our countries? I come from a background to say, in the constitution of WHO says, there is the health security, the enjoyment of the highest health, and then the health security of any population, any country, any region, is the responsibility of the individual and the states. This is in the constitution, the preamble of the WHO. I am always adding a responsibility of the institution, families, communities, private sector, civil society, non-governmental organization, charity organizations, and member states. And that's where the social cohesion and the social contracts and the social responsibility will come. What we say when we ask about our rights, we do not talk about two things. We do not talk about the responsibility and accountability. And accountability, the government has an accountability, institutions have an accountability, families has accountability, as individuals we have accountability. Today, our youth in most of our countries are becoming the highest smokers compared to other regions. Our women, young girls, are smoking highest. Again, we are not, these are all going to have repercussion on health. So this means money. This means I need to bring funds to invest on the people who are becoming more sick. The same goes in terms of nutrition intake and healthy diet. The same goes in terms of the healthy lifestyle and physical activity. These are the two links. I'm making it simple, but also as institutional level, these ministries, and we are working with them very closely. We call it two things. The National Health Account, what does it mean in investment of government, institutions, and others in health services, be it preventive, be it curative, be it rehabilitation, not to forget rehabilitation, especially if we have disabled population. We are in a region of conflict zones and wars and كل شيء, and we have higher number of people disabled, whether mental or physical, need services, but also promotion. And our aim in the health sector to have healthier health workforce, Dr. Ari, healthier health workforce, healthier institution. We have hospitals that are health facilities that are environmentally friendly. Some people call it green. We have schools that are promoted to be healthy. We have universities that are healthier. We have workplace toward the golden awards to be healthier. And this means the responsibility, accountability from individual to the states, and this goes both ways. This is for me a very critical message. I usually call, people call about 3 P's, I call 4 P's. My 4 P's, public, people, before I go to private. Public, people, and people can be women, men, any human being, disabled, migrants, refugees, that rich, poor, then private and partnership. Private sector has a say, but they should not be overwhelmed and taking the money from the people and the oath that we have taken and the protection we have taken. I just want to say the health security pandemic showed that no country is immune, no individual is immune, even if you block even if 3 months you close your doors, because the virus, the sickness will come. So it's actually a shift of mentality, how to protect ourselves, being through well-being, but more importantly, how we transform the mentality of sickness to health, to a mentality of traditional Western model of care, to a transformative healthcare that builds on the promotion of health. In Egypt, for example, a country that I serve, they have 3 initiatives that I'm always saying. It talks about rights, how the vision to be translated. The 100 million Saha, it doesn't say 100 million people sick, 100 million people Saha. There is a decent life, Haya Karima. Haya Karima talks about decent life, protection. Now, the translation is the balance between the financing and the translation of the well-being of the different levels I spoke about. I took a lot of time, but thank you for this opportunity again. I just want to tell Reem that as a young professional, my main passion was to teach the woman how to do self-breast examination, how to protect this, and it was started volunteer, aside also a group of supporting the women, the survivors, and the women who were having the cancer. So that's my initial, and it's still my passion and continuing. So well done, Reem.
Thank you, Doctor.
Thank you very much, Dr. Naima, for sharing. And there is a big link or a very important link between finance and healthcare. So thank you very much for sharing and for the passion. And since we're coming to the end, and I would like to give an opportunity and invite each of our speakers to contribute to a last thought, a recommendation in 1 minute or less that addresses the question of how we can mainstream, embed DEI in the healthcare cultures and practices, and the strategies that we need to deploy to change working cultures and make the health sciences and STEM overall a fairer, more flexible, and more equitable sector for women to flourish. So let's start, Dr. Reem, from your side, and go, Dr. Hanan and Dr. Naima.
Yes, sure, Hanan. Yumna, sorry. I think my main message or my main thing I want to focus on, and it's now the time to translate all these commitments and all these global directions into action, to translate into policies, into plans. DEI is becoming more and more important, particularly after COVID-19 and particularly with all these social movements and increasing in social accountability. But we need to translate it into plans. We need to share between each other's more lessons learned and to understand what works well and what does not, and to apply it, to divide it into smaller steps to be able to achieve it. Because as I mentioned, it's not easy. We are not used to work in a holistic way. We are not used to include everyone. So we need to acknowledge first that this is not easy, but we need to put steps and plans to start working on. Usually what we see that companies, industries, hospitals are creating functions for DEI. There are more offices across the globe concerned with DEI, but usually they are working inside the same company or inside the same institution in silo, working, for example, only within the HR team. But this has to be translated as a culture, as an environment. DEI is a way of thinking. It's not theories only. It's a culture, it's a way of thinking. So everyone should be involved within the health environment or the work environment, and not to forget our beneficiaries and our end result. I think also as women, we need to acknowledge that the unconscious bias, part of it is because of us. We need to start by ourselves. We need to believe in ourselves. We need to grab our chair and sit on the table. And we can, we need to empower ourselves and to empower each others. And I think there are a lot of room, there are many rooms of improvement when it comes to women supporting women. Maybe the last thing is not to forget to invest in human capital. To translate this into action, we need to give more training. We need to invest more in people. We need to train them more how to think in an inclusive way, in a diverse way, because as I mentioned to you, these theories and policies are great, but we need to now translate them into action. Action starts by investing in human capital at the first place. So this is in general, or in a nutshell, how I see ways to move forward.
Thank you very much, Dr. Reem. Dr. Hanan, your 1 minute conclusion, please.
Okay, I just want to know that education is the key for what we need to have or to succeed. Education, particularly for women, for young women, education, and give them the way to have the lead for, because as Dr. Naima mentioned in the talk that the women, she said she's the main member in the family. If the woman is get diseased, nothing will be done. She takes care of her husband, she takes care of her children. So education and healthcare is very important to women. Providing opportunities and mentorship are a very important pillars to, if we want a better societies. Also working like with charity organization like Rotary International, Inner Wheel, and I think these organizations are in Bahrain, in Egypt, in Jordan. They provide a lot of education and healthcare for women and mothers and the child. Nothing else. I think Dr. Naima and Dr. Reem, they mentioned all. So thank you very much for such a great opportunity for me. I really very happy to join this important discussion really for our new generation and for young ladies. And I hope to have another chance for more discussion. Thank you for Pfizer and thank you for the Arab International Women's Forum. Thank you, Yomna.
Thank you very much, Dr. Hanan. Dr. Naima, your 1 minute conclusion, please.
The pearls have been said is investing, sustaining our success, because if every one of us have a lot to share, and we really are proud of the achievements. Most of the time, we do not celebrate our achievements, and we always see the half cup. We see the cup empty instead of seeing it half cup full. This has been my success. Look at the half cup full, build on it, start from any corner. If we want to go and say 1 before 2, 2 before 1, it will not work. Go from all the directions. Sometimes they will tell you are not focused, but the focus will come to transform. We need to open our eyes differently. And I kept saying about traditional, that means we need to really look out of the box on how sustainability should maintain. Sustainability is not only money, it's the thought, it's the vision, it's the rights-based approach. How can we keep the tracking whether we are on the right track? I mentioned about Bahrain, the High Council, under her leadership of Her Majesty, the First Lady in Bahrain, always have been tracking on where we are, and they say al-athar. Did we make an impact? Sure. Many people initially thought it will not happen. It's going to be repetition. It will be. So the tracking is very important. And this is another message. The belief in the power that everyone has, and the belief that everyone has a contribution. In this case, whether women are at homes, in the field, or the CEOs of the companies, everyone has a say and a contribution. And this is where what I call the chain and holding hands to come together. The holding hands is very important. Care and love, and we see caring for carers. Caring for carers, I did not mention much, but caring for carers is not only in the hospitals, caring for carers, mothers, women, the ones who are in the field, and caring for the larger families. I'm very honored also as Irene, very pleased to be in this milestone and a great path, and congratulations for holding this session. I hope we contributed, not a repetition. We tried to also bring some key messages that you will not have any country developed unless you have healthy people, healthy population, and women have a great say on who is going to be the future generation and a healthier generation. Thank you very much.
Thank you, Doctor.
Thank you so much, Dr. Naima. And you said it very well, and I took note: to transform, we need to open our eyes differently. So on that note, we conclude this virtual panel event, the second in a series of 3 such events that AIWF and Pfizer will be co-hosting between 2022 and 2023. Please do look out to your invitations to the next event in this series, which will take place later in the spring and early summer. I hope you all found today's discussion to be engaging and enlightening, and our warmest thanks and appreciation to all our speakers who have taken time out of their busy schedules to be here with us today. And of course, much appreciation to all of you who have joined us today. We look forward to seeing you all, and thank you again on behalf of the Arab International Women's Forum and Pfizer for joining us. Thank you.
Thank you,
very
Yomna,
much.
so much. Thank you, Dr. Naima. Thank you, Reem. I'm so happy.
Thank you, Doctor.
Thank you. Thank you,
Me too.
Hadil.
موافقة دكتورة ريم.
شكرا دكتورة.
سمر.
الله يسلمك. الله يسلمك. شكرا فرصة سعيدة للجميع. Thank you very much.
شكرا جزيلا. ألف شكر. مع السلامة. سلام.